Welcome back to Lingua Practice, where language meets care. I'm thrilled you're joining us for our 8th video. Today, in part 1 of 7 common medical interpreter mistakes, bad versus good examples, diabetes case, we'll dive into a real-world OPI scenario with a child's type 1 diabetes diagnosis. We'll break down the bad interpretation step by step, highlighting key errors that can lead to confusion and mistrust. Stick around for part 2 coming soon, where we'll flip it to the good side and show how to get it right. Let's jump in. Hit like if you're ready to level up your skills.
Mrs. Marie, the tests show that your child has type 1 diabetes. He will need insulin therapy.
Madame Docteur a dit petit toi gen diabète parce qu'il mange trop bagay douce.
Diabète? C'est pas vrai. Moi pas quoi nouvelle ça. Petit moi pas même qu'on mange bagay douce. C'est parole pas ou dit interprète.
She says you're wrong. She doesn't believe you.
Now, let's break down why the interpreter in this over-the-phone interpretation scenario made mistakes. In OPI, everyone is talking remotely, so the interpreter must be very accurate because there are no visual cues like body language to help. The interpreter's job is to repeat exactly what is said without changing or adding anything. Here's what went wrong, step by step. 1. Adding wrong information. The doctor said the child has type 1 diabetes and needs insulin. The interpreter wrongly said in Creole that it's because the child ate too many sweets. This is not true. Type 1 diabetes isn't caused by eating sweets. It's an autoimmune disease. Adding this wrong reason confuses the mother and gives her bad medical information. 2. Leaving out important details. The interpreter didn't say type 1 diabetes in Haitian Creole, just diabetes. This is a problem because type 1 is different from other diabetes types and needs specific treatment. They also didn't mention insulin therapy, so the mother doesn't know her child needs insulin shots. In OPI, every word matters, since there's no way to see gestures or clarify in person. 3. Not staying neutral. Interpreters must only repeat what is said, not add their own ideas. Here, the interpreter added their own guess about sweets causing diabetes, which the doctor didn't say. This breaks the rule of staying neutral and can make the mother trust the doctor less. In OPI, interpreters must be honest and repeat exactly what is said, even if it's about their own mistake. 4. Misrepresenting the mother's words. The mother got upset and said in Creole, "That's not true. My child doesn't even eat sweets. You, interpreter, are making this up." But the interpreter told the doctor, "She says you're wrong. She doesn't believe you." This hides the interpreter's own error and blames the doctor instead. In OPI, interpreters must be honest and repeat exactly what is said, even if it's about their own mistake. 5. Causing confusion and conflict. By saying the wrong thing about sweets, the interpreter made the mother argue, "My child doesn't even eat sweets." This confusion could make her doubt the diagnosis and delay treatment. In OPI, mistakes like this are serious because there's no face-to-face chance to fix misunderstandings quickly. 6. Ignoring cultural needs. In some cultures, people might think diabetes comes from sweets, but the interpreter should have used correct medical terms in Creole. By saying something wrong, they might make the mother feel judged or confused. Interpreters need to use clear, accurate words that fit the culture and language. 7. Not following OPI rules. In OPI, interpreters should speak as if they're the person talking, like your child has, not the doctor says. This interpreter used the doctor says, which makes the conversation feel less direct. They also didn't pause to check if everyone understood, which is important in phone calls to avoid big mistakes. These errors turned a clear medical talk into a confusing and upsetting one. A good interpreter would have avoided these problems by being accurate, neutral, and clear.
That's all for part 1, folks. Hope this breakdown of those 7 common mistakes in the bad interpretation helps you avoid pitfalls in your own practice. Stay tuned for part 2, dropping tomorrow or next week, where we'll showcase the good interpretation and how to nail it every time in this diabetes case. If you found this valuable, hit that like button, share with your interpreter network, drop a comment below with your biggest takeaway or a mistake you've seen, and don't forget to subscribe to Lingua Practice, where language meets care, for more role plays, vocabularies, and tips. Thanks for watching. See you in part 2.